Health Alert is brought to you by OU Physicians in Tulsa. Hello, welcome to Health Alert. I'm Pam Butler. Today we're going to talk about temperament in children, and joining me is Dr. Robert Hudson, clinical professor at the University of Oklahoma School of Community Medicine. Welcome to the program.
Thank you. Thank you very much, Pam.
Now, you are a pediatrician, and
Yes.
so you've worked with children for many, many years.
Yes, you can tell.
And this is no,
lost
not,
my hair.
I lost your, yeah. I say even as parents, sometimes that happens to us.
That's true. That's
we
true.
want to focus on temperament, which is an exciting concept in relation to children. Before we start talking about the different temperament traits and get into the details, let me ask you this question. As parents, you know, we may have 1, 2, 3, however many kids, but we think we should raise them all alike. And sometimes we're very amazed by saying, I raised them all the same. I don't know why he or she is doing this or why they won't do that. Plus, I set such a wonderful example myself. I mean, are we supposed to do it that way? Raise them the same?
Well, let me ask you a question. If you ask 100 people, are children different? You know, my granddaughter would say, duh, Pawpaw.
Right.
You know, certainly they're
Of course.
different. So why do we expect them to respond to us all the same? Or why do we expect doing the same thing will get the same results? It doesn't. And so generally speaking, you should raise your child depending on their skill sets and their, in essence, temperament.
Okay, so we can have the same general goals. We can
Certainly.
have the same general kinds of information we want to impart and things like that.
Certainly.
But we might have to approach it a little bit differently, how we're helping each child get there.
Absolutely. That is absolutely right. And I try to help parents become teachers to teach the children the skill sets that are weak or that they lack. And that's what my practice is. I see parents who have children that I call not so easy children.
Okay.
I don't like to use difficult because it implies that they're doing this on purpose.
Or that something's wrong.
Yes, and you're born with a certain temperament, and you're either easy or you're not so easy.
Now that's the next question I wanted to ask you before we get into the specifics of these traits about how is temperament acquired. You say you're born with that. So
Right.
let's say the parent who says, well, you know, I'm pretty easygoing, pretty laid back, but my child is all over the place. If you say we're born with it,
Then I'd say,
how does that translate?
how is your husband?
Okay, okay.
Because you do inherit it. And generally speaking, one of the questions I ask is, does your child have some personality like you? You know, and we tend to, you know, take credit for the good parts of the personality and blame the bad parts on our mates, but it is inherited, and you can tell early on. And this is one of the things why it is so important to know early. In 1981, it was a cold winter day, and sort of a light bulb came on for me. I went into the first room, and the first room was a 6-month checkup. And mom and dad all dressed up, baby dressed up, baby's cooing, everything's perfect, he's on a schedule, and the parents are patting themselves on the back that they're such great parents. The next room I go into, mom's sitting in the corner, mascara running, she's crying, the baby's howling, and she thinks she's a failure as a parent. Didn't have anything to do with parenting skills. One baby was easy and one baby wasn't. And we can test at 4 months, and it has been shown that kids that are not easy that first year have more anxiety, have more depression, and so do their parents. So it's important to know early
Interesting.
how.
And the thing with that too is like you said, we can kind of inherently see that in our infants.
Right.
But sometimes we want to attribute it to other kinds of things. And this concept of temperament and being born with it, is it the same kind of thing that a person can take this temperament from generations back? It doesn't necessarily have to be that mother or that father. And you might be able to look.
Usually, if it's, yes, that's possible, but generally there's somebody from each generation. They say, well, you're just like Grandpa, you know, Bob, or whatever.
Somewhere you
Right.
might be able to pick that up if it's not just you or the father of the child. Okay, now with this whole concept of temperament then, let's sort of break down the different kinds of temperament. Overall, there are like 9.
Right, there are 9, and 2 child psychiatrists, Stella Chess and Alexander Thomas, husband and wife, wanted to investigate what's nature and what's nurture. So they went into the newborn nursery, observed children, and identified 9 traits. And then they followed these children for 30 years. It's the longest longitudinal study that's ever been done.
Wow.
And temperament doesn't change much. Now, if you're shy, can you learn to get up in front of 5,000 people and give? Sure, you can. Will you still be shy? Yes.
Okay.
So it's there. If you have a lot of energy, will you always have a lot of energy? Probably. And so those traits are inborn. They're there from the first. If you're in the mean, it can be quantified. So, I mean, you as a parent says, well, my child is really active. Well, how active is that?
Okay.
Well, with the assessment, we know how active. Are they a 6 on a 10 scale, a 4, or are they a 9? And it makes a lot of difference. Now, the perception of the parents has to come into this too.
Okay, okay.
Because if it's your first child and the child's 4 years old, all 4-year-olds have a lot of energy, and you say, oh, he's a 9, and he's really a 4. But their experience didn't compare them to thousands of other children like the assessment does. So we, in essence, take this picture that the parents have before the child's born and bring it to reality with the scores. Right.
Okay, and let me ask you this too in relation to temperament. How different infants and children respond even to strangers or to the unknown?
Okay.
There
That's a
are
good
some
question.
kids that are seem like laid back and pretty much accepting of anybody that comes into their environment, where you really wonder, do you need to teach them a whole lot about stranger danger or even familiarity? And then there are others where someone can just crest the room and they just really go out of control. I know my youngest son at the time, when he was a small child, we couldn't even go to Chuck E. Cheese because he would just lose it.
Meltdown. Yes. One of the temperament traits is called approach withdrawal. It's when you present a child with something new, do they approach it? Oh, what's that? Or do they, whoa, what's that? Do they withdraw? And I call it cautious or curious. So if they're very cautious, these are the children that are not going to run off with a stranger. But these are the children that if you try to introduce something new, they're always going to resist at first.
Okay.
Another trait is called adaptability, and that measures if you're really adaptable, you just sort of go with the flow. If you're not adaptable, your processing skills are slowed down. And if you're in a household that's a do-it-now household, there's an immediate, what we call poor fit. The child's temperament and the environment or the parents' expectations just don't fit. You've got a child that doesn't adapt quickly, but you have a parent that's demanding that child adapt quickly.
Well, let me ask you this, and we'll move on to other traits as we can get to them, but let me stay with this one for a moment here. Let's say you have that child that's very cautious, okay, and who is very kind of slow to get into, or takes more time, I'll put it that way. They're not very slow, but take more time to get into certain things. As the parent, how do we address that? Because we want them to become comfortable in unknown environments and to be able to still function, and we want them to be able to accomplish tasks. So in a home setting, what do we do?
Okay, let's take that. Let's just take the one temperament trait of cautious or curious.
Just so what, Doc? I just realized that Jake is telling me I need to take a quick break, so we're going to come back and pick right up on that, okay?
Great.
Please stay with us. We'll be right back.